Before we get started, we're at the Sports Medicine Echo Clinic. Before we get started, does anyone have any cases, questions, anything you'd like to go over? Everybody have a good summer? Okay. So if you have questions along the way, as you know, just stop me and we can talk about it. I did want to go over some new information about the pre-participation physical exam because there's a new book out. I'll show you. I've gotten all the information in the PowerPoint. So if you wanted to get this book for some reason, you could right off of there. They do have a few new things in here. Nothing that's going to probably change your practice dramatically, but I wanted you to know there's a 5th edition out. You know, it's put together by a number of different groups, but it's really published by the American Academy of Pediatrics. And then we'll talk about a few things that they've come up with. So we do have a PowerPoint someplace. Okay, so there's our statement. So this is the 5th edition. We've done this 4 times before. Those are our learning objectives. I do want to go over, in this talk, I want to talk about the mental health of female athletes, the athletes with disabilities, and then there's a whole new section on transgender athletes, which is something you may or may not experience, but it's becoming more common. So just wanted to tell you what we do with that, particularly at the high school level. There's some different guidelines for the college level, international competition, the Olympics, and professional. So the PPE it's a monograph and it's a resource, and a lot of it is not evidence-based. A lot of it is still round table, sit around the table, what should we do, because we just don't have great evidence. You can see that it gives some guidance on the timing, setting, and structure of this pre-participation evaluation, which is required in many, many places for students to participate in sports. But again, it's not an evidence-based process, and despite it having been done for 50 years, we still don't know if we're actually finding things and helping things, or we're just wasting our time and money by doing it. But having said that, it is required, so we're going to continue to do it. So we've talked about this before, but I just wanted to remind you who can do the physical exams in Nevada, because for a while there were physical therapists were on there and nurse practitioners were not. And so in this case, it's a physician, a homeopathic physician, an osteopathic physician, a chiropractor, a physician assistant, or an APN. So that got changed a few years ago. But it was kind of a problem for the rural areas when nurse practitioners weren't allowed to do that. So we managed to change that. So that's the Nevada state law, if anyone asks you. This monograph was produced, like I said before, by a number of different academies. And it's been endorsed by the National Federation of State High School Associations and National Athletic Trainers Association. So it really pertains to pre-college level sports, although we use a lot of the elements when we do pre-participation physicals at the college level. And that's where you can get it. And I think it's about $50 if you want, or yeah, there it is. If you're a member, it's 40. If you just want to buy it, it's 50. But that's where it is in case you're interested in getting it for any reason. Some of the forms that I reference are online. So if, say, you wanted to fill out the athlete with disabilities form, you can just download it for free and use it. You don't have to buy this book to do that part. But again, that's where you can find it if you want to. And I don't have any, I'm not getting a kickback for, I'm not getting a kickback for advertising the book. I got it because I wanted to do this talk and just to keep up on what's going on. But I don't think you absolutely have to do that to still be able to do a good physical. So some of the things that they've changed in this 5th guideline is they're really emphasizing the medical home. So y'all remember when we used to do physicals in the gym where there wasn't even any privacy. You just went from station to station to station, and it was loud, and of course, we didn't have a lot of time. And they're trying to de-emphasize that, but it's not always possible. And those types of situations, it tends to be less expensive for kids. So some of the kids that can't or don't access, you know, a pre-participation physical in another way may still be benefiting from some of those station-based things, particularly depending on the cost. But if possible, they would like the sports physical to be performed in the primary healthcare provider's office. And they really want the athletes or their families to complete the medical history form. Typically for kids in high school and below, I definitely want the families to be in on completing the form. And again, that's available on the website for free. If you can't perform the sports physical in the medical home with the primary care provider, then they ask that it should be done at least 6 weeks ahead of time. And you've probably also dealt with football starts tomorrow and I have to get my sports physical done today, and you listen to the kid and you hear a murmur or something, or they have something that you think, wow, this needs to be looked at. I'm not sure if I should clear them or not. And you've got parents and a kid saying, we got to be ready tomorrow. And that happens all the time. So if you're involved in these and you have the option to say, we want to do this ahead of time, 6 weeks is what they recommend to get them through everything if they do need some type of a workup. And so the history form is available in English and Spanish. There's a physical exam form, a medical eligibility form, athletes with disability. And if you happen to be seeing an athlete that wants to participate in the Special Olympics, they have special forms for the Special Olympics. And usually each state has a chapter of the Special Olympics that you could get on and download their form or get information from, because there are some specific things that Special Olympics wants before participation. We always go over the liability and ethical issues. Sports medicine, we really want to have people participate to the best of their ability. So disqualifying someone forever is one of my least favorite things to do. We would like to find a way to have people participate, even if it's maybe you're not going to play football. Can you play on the golf team, something like that, depending. What they're talking about here is some people are worried about who can we tell. You know, I'm talking about a high school athletic director. What kind of information can I share with them, et cetera, et cetera. Basically, you can tell the coach or the administrator that they're ineligible to compete or participate, but you can't really go into detail about what it is unless you have a signed medical release. And really, most of the time this doesn't happen. It's a very low risk type of thing that we do in medicine, but they just want you to be aware that there are some issues out there. And as far as disqualifying somebody for good, permanent disqualification, occasionally you may have a parent or a family who says, we don't want to do that, and we're going to get an attorney, et cetera, et cetera. So in those cases, particularly if it's something where you need a specialist, get somebody else involved. When I would disqualify student athletes, particularly based on cardiac conditions, I always had the cardiologist, at least locally, and sometimes we had a specialty cardiologist from somewhere else in the country. So the good news is if you find something that you think, hey, this is really, they're not going to be allowed to participate, it's a spinal thing, it's a neurologist, you can get the consultant, and typically there aren't a lot of issues there. Something they changed on the physical exam, and they're looking at prevention of ACL injuries and some of the patellofemoral, stuff like that. They said, gee, maybe we should put in some of these functional movement tests. If you have a physical therapist or someone like that's interested in working with you, they will do some of this screening. There's some pretty simple tests that you can do if you want to. But basically, again, there's not great data to support this, but possibly poor core strength and inadequate neuromuscular control are linked to patellofemoral pain and ACL tears. And who do we see patellofemoral pain and ACL tears in more often are the girls and the young women. So if you had somebody in your community who said, I'd like to do these tests and then I'd like to do a prehab or a prevention program for some of this, that's great. Not everybody has those kind of resources, but in some places they're starting to do it. So when they went through the physical exam, they said, really, this is the one thing sort of added to the physical exam. If you have an option to do it, it's not required. And I'll show you those two tests. So the gal on the left, see what's happening with her knees. And after she's had some training, see how she looks. So for you guys, it's probably, see how she looks with her knees spread apart and in a much more stable position. That's what you want them to look like when they jump off the box. So if coaches ever come to you, hey, how can I prevent some knee injuries? Well, doing some of these tests and then identifying, hey, that athlete might really benefit from some different neuromuscular training and some core strengthening. You'd like to see them look like the gal who looks more athletic and doesn't have her knees touching when she lands. And this is the other one. This is hard. I look like the guy with the red X. But the single leg squat test, again, you can see you're looking at core and you're looking at balance and neuromuscular control with those tests. So those are two pretty easy tests if you wanted to do some screening. They take, you know, about probably a minute to do both of them, and you could say, hey, this athlete might benefit from some additional training, particularly if you have someone who could do it for you. Again, it's not required, but it's new, and I thought you might hear about it, so I put those in there for you. As you know, I don't have to tell you this, mental health is a big issue. And they're saying, gosh, let's push down into the high school athlete level to talk about this because it's really common. And I'll tell you, at student health, it's probably one of our biggest, fastest growing areas of what we do and take care of. So they do recommend that you add some little screening tests for asking about anxiety, depression. And they've, in this form, in the new form that they're using in this book, and you may or may not be using that in your school district, they've included a little screening, the mental health question for, it's included in here. And then what they recommend is if you pick that up and you're not comfortable taking care of it, to refer to local mental health providers. Some places don't have local mental health providers. So it may be you, or it may be referring them someplace else. But again, when you see this new form, it's going to have a couple questions in there. And that's this right here. And you can see that a sum of greater than equal to 3 is considered positive. So are you nervous, anxious, or on edge? Can you not stop worrying? Do you have little interest in pleasure? Are you feeling down, depressed, or hopeless? And so those questions are right in that new form. Or you can use this too if you don't have that and you're not using a form. You can use this little mental health screening, but that's the one they recommended. There's always a balance between keeping this thing short and getting through it, but trying to cover the areas that we think are important. And they think, wow, we're seeing more mental health issues. Let's at least ask a couple questions. If you get greater than 3 on that, that might be a student that you pull aside or refer someplace for some additional evaluation. Then they have a whole section on female athletes. And one of the big areas of risk for female athletes are the musculoskeletal injuries, stress fractures, lower bone mineral density, oftentimes eating disorder, female athlete triad goes with that. Females are at increased risk for the non-contact ACL injuries. We think there are a whole bunch of reasons. We haven't identified the exact reason and haven't really been able to prevent that at this point, but we think it's probably has to do with some of the neuromuscular stuff. And then female athletes are at greater risk for patellofemoral joint pain, that anterior knee pain that a lot of them will come in with. Again, probably related to a lot of factors, but some of the neuromuscular and the strength issues for sure. So that's why they're promoting this, because there's really, I don't know if you could call it an epidemic of ACL tears in young girls and young women, but there are many more than in the males. And female athletes also seem to have poor outcomes and more likelihood of complications with concussions. So again, evaluating them for, have you had a concussion? Do they have any of the things that might complicate a concussion? Migraine, depression, anxiety, a learning disability, et cetera, just so you can identify that if it comes up. Uh-oh, Carol Scott has a learning disability and migraines, and she just got a concussion out on the basketball court. when she comes in to see me, maybe I ought to address a few more of these things, or be on the lookout for some post-concussion symptoms. Nutritional concerns in young girls and women, again, the disordered eating, the overexercising, those can both be part of that whole female athlete triad spectrum. Concern about weight. As far as the mental history goes, again, the female athlete triad, the disordered eating, but anemia may or may not be disordered eating. Sometimes young women have heavy periods, aren't replacing with enough iron, which is hard to do just in your diet. So those are some issues. Pregnancy, you know, that's a whole different issue, but something that you want to know about. They can participate in sports in pregnancy up to probably about the 16 to 20 week mark if they're doing well, depending on the sport. But again, that's probably not something that you want to be managing. A lot of times we don't know though, so we're managing it and we aren't aware. So pregnancy is something just to keep on your radar. This low iron and anemia, again, heavier frequent menstrual cycles, not eating well, and they're particularly at the college level, oftentimes they'll do a screening CBC and ferritin. There's some limited evidence that probably a ferritin of 40 to 50 is optimal for athletes. And I would tell you that when we were screening the cross-country athletes, almost all of them came in with a ferritin of between about 10 and 20. I think I wrote iron for everybody. Do we have any studies that say that really helped a lot? No. It might help a little bit, but there are people that are doing it. And if you have somebody with heavier frequent menstrual cycles, not eating well, checking a ferritin level may be helpful. And a lot of times they do feel better on an iron supplement. So athletes with a disability, again, we want to encourage participation. They get the same benefits from sports participation as everybody else. They may require some accommodations, and that may be something that you're able to write for. It may be that they're seeing some type of a specialist that could help. But there is a form that's a supplement to the history. So if you're clearing someone with a disability and you want to be able to say, hey, we need to have this, this, or this for them, that's, again, that form is in here, and it's free on the AAP site. So you can download that form if you need to. And then the additional forms for the Special Olympics, that's the Special Olympics Nevada website. So if it's somebody from a different state, you'll have to go to that state, but that's at least the current site if you had that come up. Have either of you seen, or anybody seen, a transgender athlete that you've had to clear or to have participate? It's evolving, and we're trying to figure it out to make it fair for everybody. And so at every level, this is being addressed. And again, I think everyone's still trying to figure it out. A transgender person is one whose gender identity is different than the sex they were designated at birth. You can see that I put the policy regarding competition is evolving at all levels. And at the high school level, I'm going to tell you about the state of Nevada policy. The NCAA level, that's, you know, they have some more concerns as folks have passed through puberty about biological males and biological females and how they compete on men's and women's teams. And the Olympics have their own rules and regulations. International competition has its own rules and regulations. So lots of things are changing. Some of the recommendations are controversial. People have lots of different opinions. There are certainly some psychological challenges with this from all sides. But the whole idea still is to try to get people to have access to sports. So in Nevada, you can participate on a gender-specific sport team that's consistent with your public gender identity. You don't have to be on hormones. You don't have to be a 15-year-old who had some type of a sexual reassignment surgery. You can simply participate. So if tomorrow, I'm just going to say, if I am decided I'm Charles Scott and I'm a transgender male, I would be able to participate on the boys teams in high school without any type of medication or surgical intervention. They do say that in making a determination, they may include things either from the school records, daily activities, documentation from a parent or a psychologist. So they'll look at these on an individual basis. There have been a few in Nevada, and it really hasn't been an issue. There is an issue that's going to the courts in Connecticut to transgender females. So these were biological males who, transgendering to female, were participating on the Connecticut track team, and they were awesome, and they beat all the other girls in the divisions by a lot. And one of the girls that got beat said, hey, because these two transgender girls were in competition, I got 7th place instead of 6th place. I had to get at least 6th place to be able to participate in the state track meet. At the state track meet, I could have been seen by a college recruiter, and now they've taken away my opportunity. So the courts are going to decide what to do. It's not, like I said, it's not clear, and you can think through that. I can think about all sides on that, and I'm like, well, somebody smarter than me is going to figure that out. But you may see that that's been a concern. If you look across the country, well, I think the concern is males participating on female teams, biological males or transgender females. But the bulk of them, those transgender females, they're not acing things and beating everybody and participating just to win in the girls' sport. Many of them aren't anywhere near as good as the other girls that they're playing against. So this is sort of a special issue in Connecticut, but we may see more of it, we may see less of it. I don't think anyone's ever going to say a 14-year-old has to be on female hormones for a year until she can participate against other females. So it's probably something that'll keep coming up. So follow Connecticut if you're interested. The courts will decide there. Okay, does anyone have any questions about any of that? I went through that kind of quickly, but there's not, that's what they're recommending. Look at the girls a little more closely for the ACLs. Look at mental health issues for everybody. Transgender athlete comes in Nevada, they're allowed to participate based on the gender that they identify as. And there are some special things for the athletes with disabilities. I didn't go into the Special Olympics. They do need, particularly with Down syndrome, some special screening tests, but that's all available for you. So I'd say keep doing your physicals the way you're doing them. If you have input into what form people are using, like I said, the new form is a pretty good form, and you can get it for free. Or you can use what they have you use, but that one, I don't think our old form has a lot of questions on the mental health stuff, so it may be a question or two that you could add if you feel like it's necessary. Questions about any of that?
Dr. Scott, this is Krista. Not so much questions about that, but about footwear, because there's a lot of it out there, and some of it's really expensive. So for a general, normal athlete like myself, who I lift weights 3 times a week for an hour, and then I walk 2 to 4 miles every day. So just a general, normal person like me. Is there really a difference between a $50 pair of tennis shoes and a $150 pair of tennis shoes? Or because there's some big time expensive ones out there, and I've tried a couple, just tried them on, and they're comfortable, but is it really making that much of a difference?
Probably not for what you're doing.
Okay.
So, Krista, there's a couple different schools of thought on footwear. When humans evolved footwear, we put things on our feet because we stepped on sharp things or it was cold and it hurt. So we tended to get big heels and bulky and sturdy things. And then some people have said, wow, those really rigid shoes have caused us a lot of foot problems, which they probably have for some people's feet, depending on how your feet are made. So then there was this trend more towards minimal shoes and barefoot shoes for runners and those type of things. And you can go to those things, but it takes about 6 months to run and work out in those kind of shoes because They have what's called a zero heel drop, so they stretch your Achilles. So your calf and your Achilles get really sore when you move to those. But some people with foot problems, knee problems, Achilles problems, some people think we ought to have them strengthen their feet, go barefoot more, wear more minimalist shoes. Some people really do have a foot. It's just a funny looking foot and needs some structure, orthotic, or at least some, heel padding. So mostly it's just a preference of, what do you feel comfortable in and what do you want to accomplish? If you have some type of a foot problem, that may be a reason to go check with somebody else about, hey, what about this shoe wear, or what about that shoe wear? Big trend in the ultra and the marathon and the older runners, who are the ones who do the ultras and that kind of thing. Hardly ever see an 18-year-old in an ultra. They're just smarter than us. Anyway, they like those minimalist shoes, and you'll see those out there too. But if you go to something like that, there's definitely a transition for you where everything's sore. But having said that, I will have people who have a plantar fasciitis or an Achilles or something like that. I will oftentimes try to transition them to at least some barefoot at home to strengthen their feet. Barefoot running is hard to do. There are very few places you can actually do that. But again, you can get some of the lighter shoes. What I usually tell people is go to the running stores. If you actually have a running store, most of them actually are trained to fit shoes. Remember the old days when you went in and the guys to slide the slide this way, and then went and got a shoe that actually, so they'll actually do that there. They'll take a look at your feet. Some places put you on a treadmill, say, hey, you do this, you do that. But mostly it's what's comfortable. So I wouldn't probably spend the $150 on the shoe. If you're a big time runner, you might look at something in the $80 to $90 range. But if you're doing weights and walking and not having any problem with your feet or your knees, just save your money for something else.
Okay. Yeah, the only time I would ever run is if I'm chasing after my dog. So, that would be it. But and I'll pass that on to, I know sometimes parents have questions too about footwear, and what's trendy seems to be what kids want, and sometimes it's really expensive. So
yeah, I mean, you want a fair quality if they're doing something. Now, having said that, if you have a great big kid, 250-pound lineman, and he wants to participate in football cleats that are those really light ones that look like ballerina slippers, that's probably not a good shoe for him.
Okay.
Those big guys in those bigger, heavier shoes, sometimes even a high top, because that's a lot of weight to pivot, and they will, the artificial turf, probably maybe a little tiny bit of increased risk just because you have more traction on that rather than the grass that'll break away. So you put a 250-pounder who's athletic on artificial turf with a cleat that's really light, and it doesn't give them a lot of support. So sometimes we see some more foot and ankle issues in that situation. So you probably don't want them playing basketball in a running shoe, but something that's got a lot of traction, because again, speaking of ballerinas, they never tear their ACL because there's no friction between their feet and the floor. And in basketball, it's when that, usually a lot of times that foot can get caught, or there's a lot of friction, and then you go in the wrong direction. That's where you get those non-contact ACLs. So there are probably some times when you would say you really do want that kid in a better shoe. But in general, probably not a huge deal. You would want a soccer player in some cleats if you can, rather than just a plain old tennis shoe, at least when they're getting to the high school level.
Okay. Speaking of ballerinas,
too, Krista, out there that kids can, so sometimes they'll get a wrong cleat. A turf shoe has a really low cleat because, again, the turf doesn't break away, where a grass shoe has a long cleat. So if you have a lot of kids in long cleats on artificial turf, you may see more foot and ankle injuries.
Okay. Speaking of ballerinas, though, something I do see with ballerinas every once in a while, and sometimes even with runners, is that stacked big toenail. Have you seen that? where it's almost like the toenail grows underneath the other toenail and pops it off. And then they come in and they'll have like 5 or 6 toenails stacked on top of each other. And sometimes they lose the toenail altogether. So you guys see a lot of toenail injuries at your clinic?
Yeah, we do. And I'll tell you, you know who I see that in are the ultra runners who do a lot of downhill, or the hikers who are doing downhill, and you're hitting the end of your shoe and you keep jamming that nail back. You got to make sure you teach them how to cut their toenail the right way, so that they don't cut the edges off and get ingrown toenails, and then get them in a shoe with a little wider ballerina. You know, they're just stuck with their own ballerina thing because they are on their toes and they have to wear those shoes. But the other people in them, they probably need a little wider toe box and maybe a little longer shoe because they're hitting the end or it's pushing on it. And then that nail bed, it keeps responding to trauma, you know, and it's going to get thicker and thicker and thicker. So that's a mechanical problem, and they do need to change that shoe somehow. Sometimes too, it's too big and they're sliding a lot. So that needs, you know, that shoe needs to be looked at. Yeah, you can prevent some of those. The ballerinas are hard. Those folks have lots of different things due to they have an extreme sport. They really do. And they have a very short career. So.
Do you guys do a lot of ingrown toenails at your clinic?
I would say we see a fair amount. In the old days, we used to always do a lateral matrix or a medial matrixectomy where we actually, you know, did the whole surgery, took the nail off, put the phenol. And nowadays, I do a lot more of just a little wedge resection where I just cut that piece out and then try to let it grow out. So I don't do quite as many of the permanent removals. A lot of times we'll just there's just a piece in there and I'll take that out and let it grow out. Again, we have a lot of our students are young, so they don't have those chronic toenails that have done that for 50 years yet. Some of those I'll just send off to the podiatrist because they're better at anesthesia and they're using laser and everything else right now for some of those kind of things. That, you know, the phenol, sometimes the nail doesn't grow back, but a lot of times it does anyway. So they have some better, especially with the laser, they have some better things than we do nowadays.
All right, thank you.
All right, see if you can find a case for next time.
Yeah, I started my new clinic on Monday, so it'll be a new adventure. So.
Okay, good. Well, we have Dr. Palacio next month. I think he's going to talk about common fractures. So fractures that we would see in primary and urgent care clinic that we could probably treat, and if we can't, should we refer? So that should be a good clinic. And then, like I said, if you have any cases or you want to present one, let me know and we'll do that.
All right, thank you.
I'm going to throw up a quick survey for you guys. It's just 2 questions. You can do that before you leave. That'd be great.
Thanks. Have a good day.
Thanks, guys.